Hi, I'm Dr. Rob Endicott of the Quayside Dental Practice down in Eastbourne. Many thanks for taking a quick look at this video. I just wanted to let you know of some of the ways that we like to do dentistry down here in Eastbourne. One of the things I'm very conscious of is, and I know this sounds obvious, is that people generally are not that big a fan of going to the dentist. And this ranges from people who stand in our doorway of our surgery literally shaking with fear, down to people who are just feeling as if really they'd rather be somewhere like outside here on a lovely sunny day, walking around the boats, having an ice cream. There are better things that you could probably find to do with your time. So we go out of our way to try and make life as easy for people as possible. A lot of dental practices and dentists talk about, gentle dentistry and just being, light-handed and that sort of thing, but we like to go a lot further than that. One of the things I do a lot of is something called intravenous sedation, where we actually, like they do in hospitals, you actually make someone exceptionally drowsy when they're in the chair. And then you can crack on and do 3 or 4 hours work for a patient, and you lie there completely happy. You don't care what's going on. We give the usual injections in the mouth, and you don't feel those, and you don't care about them. And the 3 or 4 hours tends to feel like about 10 or 15 minutes. It's very pleasant to have done. You're left at the end of it with quite a nice feeling as well. So and some nice happy memories. So yeah, that's what we do a lot of. Coming down from that, we do a lot of work where we just give people a tablet that they take when before they come in, and that just makes them a lot happier. It's as if you've just had a couple of glasses of wine, so it's quite friendly stuff. If you want sort of just drug-free dentistry, then we do lots of things like injections, for example. We always use a numbing gel first. It's a bubblegum flavoured gel. We put on the gums. It numbs those quite nicely, and then we can put the injection in, and you really shouldn't feel the prick of the needle. The other thing we do is that we warm up our local anaesthetic. We get it to body temperature so that when we actually put it in, you shouldn't actually feel the stuff going in either. We like to avoid occasionally doing those really big injections at the back that you have to do when you're doing lower teeth. So we've got a few clever techniques where we can actually do it right next door to the tooth, and it's a lot more gentle to do it that way. We've got techniques for things like root canal treatments, because that's got such a bad reputation, because people always say that it hurts. And if it's not done right, then yes, it can hurt. If it's done correctly, with the proper level of anaesthetic, then in fact it should be a doddle. It shouldn't be a problem at all. So we try and look at everything we do and try and get things as comfortable for patients as possible. When you're lying back in the chair, we have tellies on the ceiling, we have noise cancelling headphones so that you can listen to some music while you're having stuff done, and generally we just try and treat people fairly nicely. If this is at all of interest to you, give us a call. Our number should appear at the bottom here of the screen somewhere in a second, and we'd be delighted to hear from you. Many thanks.